Good morning. It's a pleasure to be here to present part of our research on non-cancer effects of radon and partial radioactivity exposure. This has been our research over the past 6 years. This is kind of a new research because we know radon is mostly related to cancer, especially lung cancer. So today I'm going to give you a brief introduction of our research, exposure assessment, publication studies, and closing remarks. So as we know, we are constantly exposed to environmental radiation coming from outside Earth and inside Earth, such as radon. And this environmental radiation interacts, what we are researching is, this environmental radiation interacts with air pollutants, and it affects their toxicity. And we are finding that the interaction between radon and particulate matter, that's PM, increase the toxicity of PM, increasing the radon-related risk to cardiorespiratory disease, immune-inflammatory disease, and pregnancy outcomes. So, as we know, radon is the main source of ionizing radiation. Radon can be related to geological process, meteorological process, and also industrial areas, and also can be affected by the concentration of pollutants in the environment, where radon progenies can get attached to PM and can increase its toxicity. So I will turn to this industrial fracking activities also can affect the concentration of radon in the environment. This is an important study that we published in 2020, where we found that fracking areas we had an increase of beta particle radioactivity, what is linked to radon activity. This is an important finding because it can affect, for example, areas, neighborhoods around fracking areas, increasing their health risk. So one important limitation of our studies is the access to a temporal radon data. At the beginning, we started using the spatial data from the Lawrence Berkeley National Lab. And this is it's a good model, but it's not give us, for example, we can investigate temporal analysis, although we used this at the beginning. We see here, as you saw in other presentations, that higher concentrations of radon can be found in central and northeastern USA. What is interesting to see is also fracking areas are also, they are in the same areas that we can find higher concentration of radon. And this can increase the health risk in these areas. So our research, we are using exposure assessment, mitigation to control and reduce exposures. Our data, we are using radon by zip code, counties, and homes. And we are fortunate because we have worked with a private company, radon company, that has provided us temporal radon data since 1980s. And we also have worked with EPA data that they don't have radon data, but they have alpha, beta, and gamma activities data that's linked to PM. And also we are investigating their association with radon, and they are strongly associated with radon exposures. We also have some radionuclides related to radon decay process, lead-210 and polonium-210, and also biomarkers in the presence of radionuclides in urine and in blood and hair, and also in cadavers. Another exposure assessment that we have worked is the presence of long-lived alpha particles in archaic air filters, where we can estimate indoor exposures and outdoor. Based on that, we created an indoor to outdoor alpha ratio, which means when we have a high indoor-outdoor ratio, alpha ratio, indicates that home has the main exposure of the home is from indoor radon source. Our publications, now I'm going to show you some of our publications. It's important to keep in mind that we want to understand how radon affect the toxicity of pollutants, and we found this in our studies. This study was, we investigated the concentration of the polonium-210 in brain and in pulmonary tissues in autopsies conducted in the city of São Paulo. This is an important finding when we found, let me see, no, I'm not sure how to do it. So the olfactory bulb here in the brain, if you can see, we found the higher concentration of polonium-210 in comparison to other tissues. Also, the concentration of polonium-210 was associated to the concentration of black carbon in lung tissues in non-smokers, saying that it's not only linked to cigarettes, but also linked to traffic. This is an important finding because if we find higher concentration in olfactory bulb is in a region close to the central nervous system, and it is between the olfactory epithelium and central nervous system. In this area of the central nervous system is most linked to neurological disorders such as Alzheimer and other disease. So this can be an indication that radon exposures are linked to this disease. This is another study where we're trying to understand how radon increased the toxicity of PM in Medicare beneficiaries. We investigated this area in Mid-Atlantic and Northeastern US for over 14 years, and we analyzed 87 million person years. We used Poisson survival analysis to investigate. This is a very important study because this is linked to all-cause mortality, not only cancer. We also investigated population at risk, some populations more vulnerable than others. For example, people with diabetes were more affected by the concentration of radon, increasing the 2.31% risk associated with PM exposure. When we add radon to PM exposures, we found that radon increased 2.31% of the risk of people with diabetes. We also found that there were an increase for risk mortality for patients with COPD, heart failure, and in the stroke almost there, 2.83. So this is another study where we investigated also how radon can impact the PM risk in 180 cities in the US. So we found, using a two-time series analysis, we found that radon increased the toxicity of PM, especially during spring and fall. And mostly in this study, we found that radon levels were higher in spring and fall. When we have higher levels of radon, there was an increase of 3.73% in the total mortality. And when the levels of radon were lower, 10th radon percentile, we found that there was only 1.95% increase in the risk in total mortality. So this is another study where we investigated the association between indoor radon exposures and hypertensive disorders in pregnancy in patients, health patients. So these patients developed hypertensive disorders over the pregnancy time, and we analyzed it. We had this data from Massachusetts Birth Registry data. So we used this model. We used the the data from Spruce Environmental Technologies, and we calculated monthly radon exposures by zip code. We also adjusted our models for pollutants and meteorological parameters. So this is the most precise radon data.
When you say that you found more radon in spring and fall, and how are you measuring that radon during that time frame, correlating all of this with all the information that you guys are finding?
Yeah.
Is this a long-term test that you're leaving at people's houses?
Oh yeah, yeah. That study, the previous study, you were asking about this study. Yeah, this study we used the Lawrence and EPA model radon data. That is spatial, not temporal data. But we found the effects of radon occurred on spring and fall. Mostly it related to PM, because this is when we analyzed the effects of radon, we found a significant association during spring and fall. But we didn't use temporal data. And also in this also we use spatial data. We use meta-analysis and meta-regression. We use radon and the meta-regression to know which season was we could find significant association between radon and PM effects. So here we use a logistic regression analysis to investigate the association between indoor radon and hypertensive disorders in pregnancy. So over 975,000 women, 3.7% developed hypertensive disorders in our study. We found that radon increased in 15% the risk of the women to develop hypertensive disorders, and younger women, surprisingly, were more affected by radon exposures, showing an increase in a risk at 38% increase in the odds of hypertensive disorders. This is an important study too because it shows only mothers and the fetus can be affected by radon exposures. So this is not a long chronic. We are observing since the beginning how people are affected by radon exposures of their lives. So this is another interesting study where we found polonium-210 in placenta, maternal and fetal placenta. We found higher concentration in the maternal placental portion in comparison to fetal placenta. We see here the red, this is the number of patients, 1 to 8, and we had only 8 patients because we started the study right before the COVID pandemics. So and after that we only had patients with COVID and we stopped, but we continued the study. And this is under review, it's not published yet. And we found polonium-210 in placenta tissues. So this is interesting and important because it shows that kids can be a lifelong disability linked to earlier radon exposures. So in conclusion, what our studies are showing is we have evidence that radon exposures are linked to non-cancer health outcomes. These levels of radon are much lower than the guidelines, the health guidelines, which means we need to recalculate radon exposures to put in the guidelines, write the effects that is linked to the radon exposures. So this is, I'm representing my group, Petros Koutrakis, and we have a lot of many partnerships and collaborations, international collaborations. We are collaborating with Spruce Environmental Technologies. They are providing us temporal radon data. We have collaboration in Brazil, where we are investigating the presence of radionuclides in cadavers and placenta, and other studies. So thank you so much.
Do we have any questions?
Yes.
Yeah.
Yes.
Do you have a hypothesis on how radon could interact with the heart and blood pressure on those findings?
Yeah, what happened is when we inhaled radon with particle, usually radon progeny get attached to PM and we inhaled, and that's why the concentration of pollutants are so important, because they carried radon progenies inside our lungs, and it deposit in the lung tissues, and the blood can carry over tissues, can be directly or indirectly. Directly can carry progenies to tissues over bloodstream. We also have indirectly when we have an increase of inflammatory markers because of the lung is getting inflamed. So we have an increase of inflammatory cells, and that can accelerate other processes that already started in our body. For example, cardiovascular disease.
Thank you.
Welcome.
Hi, I'm Kevin Stewart with the Lung Association. First of all, I do appreciate all the work that the group has done, and it's the kind of investigation that's sorely needed. I am particularly a little bit of a follow-up to that kind of a question is the sense of to what extent you've gone through or have some papers that actually do a Hill criteria analysis for causative probabilities here. Because I think there's this issue about the possible confounding by other environmental issues that are also potentiated by the same kinds of factors that potentiate radon in indoor environments. And so to the extent that those can be teased apart would be appropriate, and also to what extent you can demonstrate the strength of these associations as independent from those other kinds of possible agents that are also inflammatory. Those would be helpful. I don't know if you have a remark on that, please.
Yeah, I agree, completely agree. These are observable. This is, of course, we have a lot of limitations in the studies. Well, I didn't mention. We never mention limitations, having some difficulty to put limitations in our studies. But it is, yeah, also, most of the studies, we believe the exposures come from air. But not some of, for example, in pregnancy, for this study in placentas, we also have other sources, water, we don't know. So yeah, I agree. But these are numbers. What we run, we find. There is, and what is good of this research, we don't need to do any massage on the analysis, is there. Like what we find is there. And not only for radon, but other environmental radiation too.
Okay.
We found significant effects. Yeah. Okay. Thank you so
Yeah,
much.
thank you.
Thanks for a question. Yeah.
So I do have a slight, I'd like to talk to you more personally. But when you talk about PM10 and radioactivity that's maybe attached to PM10.
Yeah, sorry, it's PM 2.5.
2.5, yes.
Yeah.
A large majority of any radioactivity attached to 2.5 is going to be beryllium-10. As you know, beryllium-10 is going to, I believe, outweigh anything. And that goes on not only a seasonal cycle, but also on it's inversely proportional to the solar flux.
Yeah.
So it seemed to me beryllium-10 would be a complicating factor here.
Oh yeah, we are investigating all these radionuclides, and that's why the third picture, we are investigating sources from the reactions from cosmic rays and isotopes in the environment, and also solar activity and all this process, and how it interacts with radon decay process, and also with radon great toxicity, no, but how they interact with each other. Yeah, can be, it's interesting because we have significant association between among most of the environmental radionuclides. It seems also we are adjusting our models for planetary boundary layer that can affect, because we have the movement of the atmosphere that can bring all radionuclides together and expand them together. So we find a wrong, they are not correlated directly, but indirectly because of the movement of the air in the atmosphere. So yeah, it can be, but yeah.
So the other question I had, I'm a radiochemist, and one of the things that bothered me was your polonium-210.
Yeah.
Notoriously very difficult to measure. Do you know if they're measuring it from the beta from the lead-210 or from the alpha from the polonium-210? I mean, it's 2 picocuries per gram is really low, and it's very hard to measure.
Yeah. It's really hard.
My apologies, everyone. We are over time. If we
Yeah,
could
it's
kind of
okay.
take this
That's okay.
offline so we
Yeah,
can keep the
sure.
schedule moving.
We can
Thank
talk
you so
later.
much,
Thank
Carolina.
you. Thank
If
you
you would
so much.
maybe follow up with this gentleman.
Okay, thank
That'd
you
be
so
great.
much. It's not my
Yeah,
fault.
we'd
I have one real quick question. One real quick question. It deals with just air quality in general, okay? And the reason I say this is what studies have been done. So, and I'll keep it in the simplest terms. When you're doing mitigation, okay, we get a lot of requests for people who move into a house, they're continually coughing after they move in. You do mitigation, and then the coughing all seems to go away. And how the air quality changes by taking that, I'll call it nasty air out from underneath the house.
Yeah. We actually now, recently, we are measuring directly radon, indoor radon, to understand all this process, because sometimes if we use an instrument to mitigate radon, we affect the air quality, other air quality. So we produce others, we need to understand how sub-products we are affecting, can be good or bad. So in order to have a good mitigation process and good mitigation to reduce exposures. But I don't have this answer yet.
You know,
but
yeah, because it'd be nice to know how the air changes in a basement or in a
Oh
house.
yeah, I have this talk on one something today, because we investigated the upstairs basement ratio, and to understand how they can be affected by indoor
Air quality.
Air quality, yeah.
Okay.
Yeah.
Thank you so much.
Sorry.